According to the Department of Health in Hong Kong, 99.4% of elderly aged 65 to 74 were reported tooth decay. 55.3% of them had gum pockets. 21.5% of them had wood surface decay. And 40.3% of them had only 20 or less remaining tooth. Why does the tooth problem remain so important in the elderly? Sam Shui Po is located in northwestern part of the Kowloon Peninsula. This small district had population of around 380,000 in 2001. Chinese occupied 95.3% of the population. 52.3% of them had educational level of secondary and lower. Labor force participation rates were 55.8%. Median monthly income from main employment of working population, excluding unpaid family workers, was 10,420 Hong Kong dollars. Sam Shui Po has been considered as one of the highest density of elderly living districts, which has about 70% of population were aged 65 and above. So, we are going to Sam Shui Po to see the real life of dental health problems. We analyze the data from the street interview. Through the street interview, 22% of them had regular checkup in 2 to 3 years. 30% of elderly would have regular checkup as tooth feeling discomfort. 29% of elderly never have regular dental checkup, and 12% of elderly have regular dental checkup in each year, and 7% of elderly have regular dental checkup in each half years. For the reasons of difficulty of dental checkup, 35% of elderly think that the pace of the dental clinic is not convenient for them. 50% of elderly think that financial problems is the biggest problem of them to have a dental checkup. 11% of elderly think that it is not necessary to have a dental checkup. 14% of the elderly don't know where they can seek for dentists. As previous said, dental health problem will directly affect daily life. However, does elderly think that would affect the life actually? 18% of elderly think that it is a moderate affect their daily life. 2% of elderly think that it is the natural process that humans should be facing to. Around 60% of elderly think that poor dental health would have a negative impact on quality of life. It is because poor dental health cannot enjoy the taste during eating. Some of the food like meat, which need more force to chew. And 20% of elderly think that it is just a provide a little bit inconvenience during their life. For the percentage of elderly know the healthcare voucher can be used in dental clinics. 80% of elderly didn't know the healthcare voucher can be used in dental clinics. For the service given by government, dental service on different age group but target on children mostly. For the free emergency dental service treatment, there are only 11 government dental clinics of Department of Health, and most of them located in new territories with very limited service hours. For the emergency dental cover treatment of acute dental disease, doctor's prescription for only pain relief, treatment of oral abscess, and teeth extractions. For the Comprehensive Social Security Assistance Scheme, we call it CSSA. It provides dental grants to CSSA recipients who age 60 or above, disabled or medically certified to be in ill health. Also, eligible CSSA recipients can approach the dental clinic designated by Social Welfare Department for dental examination and cost estimations, which subsidize them to receive specified items of dental treatment provided by private dentists. Besides, Community Care Fund rolled out the Elderly Dental Assistance Program in September 2012 to subsidize low-income and needy elderly for receiving denture and related dental service. In 2009, the government launched the Elderly Healthcare Voucher Pilot Scheme to provide financial subsidies for elderly who age 70 or above to be 2,000 since early June 2014. Also, Outreach Primary Dental Service was set up by the NGO, which provide basic dental care service to elderly in only residential care home and daycare centers, such as HKSAH Lady Medical Center, Dongwha Group Hospital, and Lo Sin Tong. Moreover, there are 9 categories of healthcare professionals registered in Hong Kong and take part in the healthcare voucher, including Western medical doctors, Chinese medical doctors, dentists, chiropractors, registered nurses, physiotherapists, occupational therapists, radiographers, medical laboratory technologists,